Good afternoon. I'm Dan DeRose with 19 News, coming to you from our digital desk. We have a very serious topic to talk about when we start thinking about how cold it is outside. Today, it's going to be again tomorrow, really for the rest of the week, pretty frigid, well below normal from what we should be. 13 degrees outside. When you look at downtown Cleveland right now, boy, that looks beautiful. It looks like we've got some sunshine. But unfortunately, it is very deceptive. It is cold and it is dangerously cold. In fact, in Cuyahoga County alone, so far this winter, so that's 2024 and 2025, so far this winter, we have had 5 hypothermia deaths in the county. Just when you start thinking about it, what a terrible way to pass away, to be cold, whether that's somebody who's out in the exposure, somebody that maybe doesn't have a home, a warm place to go to. When we start comparing that to years past, in all of last winter, Cuyahoga County had 7 deaths from hypothermia. The year before, there were 12. The year before that, there were 11. So already we've got a couple of months to go, and this is going to be a rough week. According to the medical examiner, we've had 5 so far this year. To talk about this as a public health issue, we're going to bring in Dr. David Margolius. He is the director of the Cleveland Department of Public Health. Dr. Margolius, thanks for joining us. How are you today?
I'm good. Yeah, thanks, Dan, for having me.
Real serious topic here, and we can all complain about the cold and then laugh about it. But when we hear that 5 people so far this winter have died, unfortunately, this is no longer a laughing matter.
Yeah, I think the biggest takeaway from for me when talking to the medical examiner, Dr. Gilson, is that some of the folks who have died this winter were inside their home. Some had heat in their home and it just wasn't turned up high enough, and some had heat in their home and it wasn't turned on at all. And so it is dangerous when it gets this cold, especially for folks over the age of 65.
What is it about being older, and I'm probably throwing you a softball here, but what is it about being over the age of 65 that makes this cold? And we see this in the summer with the extreme heat. What is it? Is it just from being older, or is there a particular problem?
Yeah, no, it's just unfortunately just the circulation doesn't work as well to regulate body temperature. And so if you're in your home, if it's very cold outside and your heat is not set above really 65 degrees in some cases, your body temperature can drop below 95 degrees, and that's when hypothermia sets in.
And I think that's going to be surprising to a lot of people. We think about our homeless population and how that exposure could lead to a death. But when you're saying this year, we've even seen people who are inside their home. They have heat and they're dying. Kind of get into that. How does it happen? Why does it happen? And there's probably sometimes just not an answer.
Yeah, no, I think for me, when I hear this news, when I learn about this, my big takeaway is please, you have relatives who are older, you have neighbors who are older, check in on them. I think all of us are so glued to our phones and social media that we've lost that ability to just check in on our neighbors and our relatives, kind of in person, by the phone, to make sure that they're okay, that their heat's on, that they've got enough layers, because those are the folks who are most vulnerable, especially when they're isolated.
And you think about sometimes how money is a struggle for those who have retired. Maybe
Yep.
they're on a fixed income and they don't want to put their heat up above 65. That can also be a rough situation. Let's talk about anybody who spends any time downtown. Unfortunately, on occasion, whether it's by the steam tunnels that are under the street and you see people on the sidewalk, is there a general rule of what should I do, especially when it's this cold? Is there somebody that we should call? Is there some way that we should be able to get some of these individuals some help?
Yeah, the good news is, so we launched our Home for Every Neighbor program in the city of Cleveland last spring in anticipation of really the high heat days of the summer and then going into the winter. And we had a goal to house 150 people directly from the street who had been living in campsites and on the street. And that goal was 150 people in 18 months. I'm proud to report that just about 10 months later, we're up to nearly 140 people that we've been able to house. So you will see many fewer people who are forced to kind of live in campsites outside right now. A lot more people who are in homes, and so we've been running that program very successfully. There's still a few people out there that we're aware of, and we're getting to. But we've got programs, and you can call 311 to get connected if you're in the city of Cleveland.
Walk us through that program a little bit. What kind of housing? And this is more than just picking someone up and taking them to the homeless shelter at
That's right.
2100 Lakeside. What is this program? Walk us through it.
Yeah, so the people who are homeless and not in a shelter are really a select population. They're folks that don't go to the shelters because maybe they've had a bad experience with the shelters. They don't go to the shelters because maybe they're coupled up, like they have a wife, and a man and a woman can't go in a shelter together. They're either male shelters or female shelters. Maybe they have a dog and they don't want to abandon their pet on the street, and so that's why they haven't gone in the shelters. And so funding through the city of Cleveland, we basically engage with folks on a case-by-case basis and find them an apartment and case management, and so that they're able to find work or apply for disability if they have a disability, which many do. And it's been a very successful program, and the city of Cleveland has never done anything like this before.
And the fact that you're telling me 140 people are no longer on the street and in some sort of transition, getting help, getting a job, having a support team, that's pretty phenomenal. When you look at the fact that it's 13 degrees outside, you have to wonder how many of those 140 would have been in some pretty dangerous situations here. As we get to the rest of the week, I'm going to give you the final word here. This has been a little bit more of a harsh winter than that we've seen maybe the last couple of years. Maybe this is reality smacking us in the face that this is what we get when we live in Northeast Ohio. You get the final word here as we head into the middle of a really tough week.
Yeah, please just check in on your neighbors, check in on your relatives, especially folks over the age of 65. It's not enough to, send emails or look at social media. I really encourage people to pick up the phone or visit your relatives and your neighbors to make sure that they're okay.
Dr. David Margolius, he is the director of the Cleveland Department of Public Health. Doctor, thank you so much for the time today and the advice. We appreciate it. Stay warm.
My pleasure. You too, Dan. Thanks so much.
All right, take care. That'll wrap it up. Again, just when we got these numbers out from the Cuyahoga County Medical Examiner that 5 people already this year have died, this winter have died from hypothermia and exposure to the cold. And as you just heard from Dr. Margolius, a lot of those people were people who had homes. These aren't just homeless people dying on the street. These are people who didn't either have heat on or didn't have their heat turned up high enough in their home or their apartment, and that's just a really sad situation. Take care of your neighbors, take care of your family. Our older population, as Dr. Margolius said, it is as simple as one phone call, one quick visit to make sure that the heat is on and operating. If we have any other breaking news, it'll be right here on our digital platforms. Otherwise, look for 3.5 hours of news and first alert weather. We are in a first alert weather day because of how frigid it is and will continue to be throughout the rest of the week. We'll see you at 3 o'clock on Channel 19. I'm Dan DeRose with 19 News. Have a great day.
19